Welcome to Health Talk, Friday Report, Episode 2. Today we're going to talk about practical problems with eye drops. As an ophthalmologist, we have many patients who complain to us about eye drops. Now, first off, we already know as doctors that 65 to 87% of our glaucoma patients do not take their eye drops on time at all or correctly. Now, that is partly our fault because if you notice, here is a nice eye drop and it's a tear and you see it's shrink wrapped and you can't get this plastic off very easily. I'm peeling it off and it's very hard. So once you peel it off, then you open it, and then as you administer this, if you push, I'm pressing with all my might, and one drop here it comes. But I'm pressing really, really hard. So my 82-year-olds and 87-year-olds all complain. So what we did was we took the same thing, as you notice, we cut off the top. And then what we do is it comes out, and it comes out more easily. But no one would think to do that. And in addition, if you notice, one has one opening. This is the uncut off one, and here's the cut off one. The cut off one has 4 valves. Why would any company put 4 valves? We have no idea. So there have been numerous reports from 1986, 1992. Glaucoma specialists have told us that 1/3 of our elderly patients live alone, 1/3 of them have other people administer them, and more than 1/3 have a difficult time putting them in. And so here is one of our drops that we use every day. This has only one hole, no valve, and it's much easier to put in. The plastic is easier to manipulate, easier to press. So if you press on this one and this one equally, see, one has more drops. For 4 drops, one comes out. So you see there's a difference. So there's a problem. And then many people have these single dose. Here you twist this off. As you twist this off, the opening's extremely small. So here, you're pressing, and one comes out. But you're pressing really hard, and one comes out. So if you take a pair of scissors and you cut this off, now people will think this is not sterile, but eye drops are not sterile anyways once they get in your eye. So here it comes out a little easier. So it comes out. But this is a problem that is universal. There have been articles written in Spain about the same thing. We think that these eye drops, the manufacturers are all in China or one place, and the plastic is made very cheaply. So thousands and thousands of bottles are made ahead of time, and nobody wants to change that. And so we're stuck with extremely difficult plastic to press. See, as I'm indenting, I have to indent so much to get some out. So it takes 2 hands. So it's very difficult for patients to do this. So we wanted to highlight this problem because it's a common problem.
Right. And so this is something I think we've seen in the clinic, but how would you, how much or how big or like how ubiquitous, I guess I would say, is this problem in this clinic?
Well, I think for all clinics in ophthalmology or even optometry clinics, everyone is using eye drops. We use them for dry eye, which affects 16 million people in America, or up to 50 million that are not diagnosed. And there's up to 6 million people who have glaucoma, either diagnosed or undiagnosed, or use some type of eye drop. So everyone's using some sort of eye drop. So it's important that they at least get the drop out. If you can't get it out, you don't get any medicine, see? So this is for a dry eye treatment. And so this would be sold at CVS, Walgreens, all the major chains. And it's very hard. So we don't expect grandma or our favorite aunt to cut them off and then find 4 valves and you still can't get the eye drop out.
Right. And that's kind of like, it's interesting, I think, because being that it's so difficult, that's actually this report that you were mentioning from Spain. Their conclusion states that the self-administration of eye drops by the elderly is a complex activity. And this is between 25 patients, all 65 years or older. Do you think that there's then potentially more, like a lot of elderly patients are then labeled as non-compliant when in actuality they just can't get the drops out.
Well, I think that elderly patients, number one, some have rheumatoid arthritis or just plain bony arthritis, and their fingers aren't flexible enough to do it, and some have issues with stroke, and so they're weak on one side, and so they may have to rely on a caregiver. What if they don't have a caregiver to give them the drops on time? And then the glaucoma therapy doesn't work because some is 3 times a day, some is bedtime, some is in the morning. So it's very hard for people with any physical deformity of their hands or muscle weakness to administer eye drops. Because here I am, luckily I have all my 10 fingers, but look, it's still hard. I'm using 2 hands. This is ridiculous. You know, one hand doesn't do it. I have to use 2.
Right.
So this is, and I'm a physician. I'm an eye physician. I care for these patients. So it's kind of interesting that many of us have had posters at ARVO and all our national meetings, and the various manufacturers have come by, but nothing has happened. These reports have been going on from 1986 to now, so it's a problem.
And that's actually really interesting, being that it's from at the very earliest, like 1986. I feel like maybe even a lot of these patients don't even know to bring this up, you know?
I think that there's a sense of fear. People are ashamed to tell their doctors that they forgot their eye drops or they don't take it, and they feel sometimes, oh, I'm bad girl, so I can't complain that I can't even squeeze them. I just didn't even take them. I forgot. So I think that's complex. And also some people, they may be turned off to using them at all because they can't even squeeze the bottle. I mean, it's a deterrent.
Right.
I mean, or they think they put it in, but they didn't. They squeeze, but nothing comes out, but they think they did it. So therefore, that adds to the number of people who don't do well with their medications. Meanwhile, they can't get the medication out of the bottle.
Well, and that's actually something that specifically, like the Spanish paper is also talking about, was that on their first attempt, 32% got it on the outer corner of their eye, 8% on the inner angle, 8% on the nose, 12% on the cheek, and then 8% in other areas. And the ones that were able to get into their conjunctival sac, overwhelmingly, it took 2 to 3 to sometimes even, for 20% of them, 4 more drops. So
Right.
Yeah.
Right. So then there's a problem now because pharmacies are counting the number of drops that you're allowed, and so there is no more room for wastage, allowing for wastage. So physicians used to be able to say on the prescription pad, please allow wastage, but that's no longer allowed because the big corporate pharmacies count the number of drops, and if you wasted 4 drops on one eye, that's essentially a waste of these drops that they're not going to give you more drops. Let's say you used up the bottle and you didn't wait the month and you used it up in 2 weeks. Well, too bad you're not going to get a bottle. So it's very hard for people on a fixed income to get eye drops and also to administer it correctly because they dropped 4 of them on their cheek and only 1 got in. So it's a multi-pronged problem. The patient does not get better because the drop doesn't go in correctly. The pharmacy is bombarded with complaints of patients who are saying, I don't have enough medicine. And then they're told by their corporate headquarters that Mrs. Jones only gets 30 drops per bottle per eye, and it's all counted out. So it's all rather ridiculous at the 50 microliter level because each drop is 50 microliters. So it is a complex problem now as everyone is aging and has more eye disease.
Right. What do you think would be like the most immediate solution? Starting with even just like the design of these bottles, which,
Yeah, I think the plastic should be easier. Like this is easier to squeeze. I'm squeezing this, and this is very hard to squeeze. I can't indent it at all. So there should be uniformity of like plastic and the actual hole opening. People have discussed this. Glaucoma specialists have discussed this in national meetings and papers. So there's no national standard for the hole size. And then that's compounded by this the the hardness of the plastic.
Right.
So there's no national standard for that, and therefore nobody is getting drops. So an easy hack, as I said, is to actually cut off the tip. So here's the normal tip, and here we cut it off. So you see it's different. And so one comes out easier, okay, the one, so that's, but it's also hard for, all the elderly to go around cutting off all their tips. So it's, an interesting problem, and I think that we as a healthcare team and also with our patients should be more vocal with our congressmen and senators to tell them that this is a problem, that the eye medications are not going in,
right,
because of the simple problem that the manufacturers have not thought about it.
Right. I mean, I think it's that's kind of thing. It's been interesting seeing that even here at the clinic, where we've had actually multiple patients go out of their way to certain pharmacies because the pharmacy that they're going to only gives them a certain number of drops, like in their medication. That these bottles are actually really difficult to get drops out of, and it sounds like at the very least that it would the industry would very much benefit in having some sort of standardization when it comes to these bottles.
Or actually, that would be a selling point. Let's say you're a drug company. You can say ours meets the standards of XYZ, right, and you can get these drops easily, and it's tested by the senior citizen committees of various nursing
right,
homes or hospital settings, because it's very difficult. In the hospital, you have nurses who will administer the drops, but when the elderly go home, they may not have a home health aide to help them. So they're doing the drops by themselves, especially after cataract surgery, yeah, or after retinal detachment surgery. Nobody is helping them, so it can be difficult.
Right. It's small things like this that I think most people don't think about until they have to think about it, and it becomes a very serious problem.
And I think it's good that the public knows that we also know, but we should make a concerted effort together to write letters to the drug companies that make them. Because I'm sure they're just thinking, oh, we put this in the bottle and we're just going to give it to you. And the problem is solved. But it isn't, because you can't get the dropouts. So
right.
Here's my left hand, I can't squeeze it out. I have to use my right hand, which is stronger, or both hands. So to the home audience, go talk to your eye doctor, tell them what you think, and we should write a national writing campaign. Thank you.
Thank you guys. Join us next week for the third episode of Friday Reports. We hope that you guys are liking the series, and if you have any suggestions about what we should talk about in the future, what you would like Dr. Wu to talk about, please drop them in the comments. Thank you so much.